Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I am Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour, where we will explore revolutionary expansion of mind, body, and soul. Join me on the first and third Thursdays, where I have experts from around the country teaching you cutting-edge therapies on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. And please like and subscribe to my channel, Dr. Diane Hayden. I'm excited to have with me today Dr. Michael Duben. He graduated magna cum laude from NYU and attended Mount Sinai School of Medicine. He completed his residency at Montefiore and Mount Sinai hospitals and obtained his endocrine training at the Albert Einstein College of Medicine, Montefiore Hospital. He's a clinical instructor at the Albert Einstein College of Medicine, is board certified in diabetes, endocrinology, and metabolism, and has been in private practice since 2003. He finished his functional medicine training in 2024 and now also has a functional medicine endocrinology practice in Connecticut. And you can find him at www.restorehealthmd.com. So welcome, Dr. Duben. How are you today?
Good. Hi, Diane. Thank you very much for having me on. It's a pleasure as always.
Yeah, awesome. So I think the first question I want to ask you is, let's talk about functional endocrinology, because I'm pretty sure that most people listening and watching this have never heard of, they know what endocrinology is, what an endocrinologist is, but have probably never heard of what functional endocrinology is. So let's educate them around that, and then we'll talk, of course, why you decided to shift your practice into that.
Sure. So functional medicine as such is a wider view of health as such. So it's based on traditional medicine with all the foundational things like metabolic pathways, pharmacology, physiology, pathophysiology, anatomy, and on and on and on. But on the foundation of traditional medicine, there is sort of a building, you could say, of a wider, more holistic approach, looking at root causes of disease with the goal of better health and restoration of function, as opposed to simply treating chronic conditions, but never trying to address either the root of the problems or ideally restoring a normal function and getting rid of the disease as such. And so, since I am an endocrinologist by training, I'd like to capitalize on it. And so functional endocrinology is sort of a subset of functional medicine, which is very broad. I'd like to narrow the scope. And so I combine traditional endocrinology and everything it has to offer with functional medicine, which again is a broader view of health as such, with a goal of restoration of health, improvement of health, and restoration of function, but with the more attentive focus on the endocrine system. It's a combination of both, but in the hormonal view.
Right. So I think people would probably, the first question is, that comes to mind probably when we're thinking about treating someone with functional medicine is bioidentical hormones, right? Like that's,
Sure.
You mentioned hormones, that's what we think of when we think of endocrinology or maybe diabetes. We'll talk about some of the other, chronic issues that you treat. So what is your perspective on that? Do you believe in bioidentical hormones? Do you like them? Do you use them? Do you not? Like what do you feel?
Right. Wonderful question. My view on it kind of went through the process of evolution as a general view on medicine and how it should be practiced. So initially, the idea of bioidentical hormones was sort of officially poo-pooed by the endocrine societies, by the expert opinions in the traditional medicine world. And so I think, as with anything else, we have to start with definitions. So what is a bioidentical hormone? It's essentially literally atom by atom, be the same molecule that it makes up a hormone. It doesn't matter what hormone even a question is. You basically are trying to mimic or create a clone or an exact copy of human hormones. So there's not a single difference between what you take, and it could be a pill, it could be an injectable, as compared to what is produced naturally by your body, and hence the word bioidentical, right? This is as opposed to, for example, synthetic hormones, like let's say in female health, that would be estrogens produced from horses' urine, for example. And so they are structurally very similar to female hormones, but different enough somewhat to undergo different pathways of elimination, creating different metabolic substances downstream, which could have negative effects. And so the idea is, if you want the best, let's say hormonal replacement, you try to replace it with hormones that are literally identical to what your body is producing. Now, that said, I have to say that, for example, when it comes to thyroid hormone, those quote unquote synthetic, the synthroid, the levothyroxine, if you talk about brand name versus generic, they're already bioidentical. They literally are atom by atom the same molecule as produced by your thyroid. The difference is, in the body, there is two major types of thyroid hormone, T4 and T3. And if you talk about levothyroxine and synthroid, it's only T4. So then there's a question, do you need to supplement with T3? We're going to leave it aside. But from the standpoint of structure, it is bioidentical. And with insulin, it is bioidentical, basically, to what your pancreas is producing. So depending on what hormone in question we're talking about, certain things that are labeled as synthetic, they really are bioidentical, and certain are not. But when you throw around categories indiscriminately, like natural or unnatural or pharmaceutical, without actually knowing the chemical structure, you could be misled. And unfortunately, misleading happens in traditional medicine, but it also happens in functional medicine. Because if you're simply selling a label like, oh, natural, then you could mislead, because a lot of things are natural that are bad for you. Natural poisons. And so just because something is natural doesn't automatically mean it's good. It often does mean that it's good, but not always. And by the same token, not everything created in the lab is automatically bad and evil and has bad side effects. It may, but depending on what substance we're talking about, could be literally bioidentical. So discrimination is important here.
Yeah, interesting you brought that up, because I think that is the way a lot of people's mindset is. If it's natural, we assume it's good for us, it's healthy, it's fine. If it's synthetic, a lot of people in the holistic industry feel like, oh, no, if it's made by a pharmaceutical company, or if there's anything chemical in it, I don't want to use it. I don't want to ingest it. I don't want to put it in my body. But like you're saying, that doesn't necessarily mean that it's bad for you. Sometimes there's synthetic things that are actually helpful.
Life-saving, in fact.
Right, exactly. And more bioidentical than we understand.
Yes. Right. Because again, narrative is everything. Whether it's politics, finance, or medicine, it's the story that drives the sale. Unfortunately, whether you like it or not, it's often about money. And so if you have the right story, you could sell it to the public that doesn't have the tools to evaluate the validity of what you're trying to sell. So words sell: natural, organic, bioidentical. There's obviously nothing wrong with organic. It's just when you talk about organic food, yes, I will vote with both, my hands for it. Yes, it should be organic, of the highest quality from a local farmer, and so on and so forth. But, if we're talking about a chemical that you put in your body, just because it's natural doesn't automatically mean it's good, and we need to discuss it. And that's why I dedicate my time to explain things to people. And so nothing is automatic. It really isn't.
Yeah. One of the things I think it's important to point out when you said you dedicate your time to explain things to people, I think that's one of the reasons you moved more towards having a functional medicine practice than traditional, because when you operate a traditional medical practice and you're sort of bound by, what the insurance company is going to dictate you can charge and how much time you're going to spend with your patient. It doesn't allow you to do things like that. It doesn't allow you to take that time with the patient to really help them understand what we're talking about.
Right. No, I certainly tried. So it's not even, you're right. But I would correct it a little bit. It's not like they don't allow me. I pride myself in being, very independent. And so it's not like they literally dictate what I say. They don't. They limit what I can do from the financial step. But if they deny a drug, okay, yeah, I can insist all I want that it's good for you. But if it's $3,000 a month every month for the rest of your life, it's just not feasible, right? But what the insurance model does not allow is time, right? Because you just don't pay enough. It's not possible for me to spend an hour and a half with a patient and make a living, right? It's just not a thing. And so that's why it has to be quality time for which you have to pay.
Yeah. Yeah, exactly.
But it's no different from anybody else, whether it's your accountant, mechanic, lawyer, plumber, you name it. It's just that, again, it's a narrative. The narrative is, and I understand that. Listen, well, insurance pays you, so here. Well, yeah, but how much? Do you realize? And what are my expenses? It's not a model that's sustainable.
Yeah, and that's the thing. I mean, one of the things that I have really tried to make an effort in doing is educating people about the insurance model. I mean, we do that in our magazine from time to time because I think we've got, people as a society have gotten into this situation of feeling like, well, insurance should pay for it because either I pay for insurance or my company pays for insurance. And so if insurance doesn't pay for it, I'm not gonna do it. And that's not taking responsibility for your health. So I love this conversation. We're gonna get much more into what you do and what functional endocrinology is. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. I'm going to take a quick break. When we come back, we will explore more with Dr. Michael Duben. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. But before we continue, I want to make sure everyone knows how to find me. You can reach me at www.drdianehayden.com or at either of my two publications, www.naturalnutmeg.com and www.essentialnaples.com. And you can learn more about Dr. Michael Duben at his website, which is www.restorehealthmd.com. That's spelled RestoreHealthMD.com. So we've been talking about functional endocrinology and the definition of that. And we kind of, we went down the rabbit hole a little bit about insurance and people needing to take more responsibility for themselves. And just, right. I think just understanding, like, why would I pay out of pocket for something? And not letting the insurance companies dictate who and where you're going to get care for. I mean, to me, that's the most important thing is I want to make the decisions of who I'm going to choose for a provider. And if I think a functional medicine provider like yourself is a better provider for me based on what my health issue is, then someone down the street who's taking insurance, I'm going to pay out of pocket for that because you're going to spend way more time with me.
Yes,
like
that's
over
about
an hour. Yeah.
Yeah, exactly. So, I hate to be blunt, but you buy my time and my expertise. And, it's not cheap, okay? Because there's been years, decades, really, of training that goes into it. And you mentioned before we went on a break, the word should. I totally empathize with people that, their premium keep going up, and there is a created expectation of, well, then at least if you need a doctor, then so yes, you have access to a doctor. But then what they don't tell you is, you know, is it enough? How much they pay to support a doctor's office? And often it's not. Okay, so the word should that you mentioned, I've heard a good line that I kind of appreciate. Should and fair is for politician and children. All right, so they have something to talk about. Yeah, well, we should all be rich and healthy and happy, and we all have rainbows and unicorns. But in this reality, right, if you want time and expertise and explanation and somebody in your corner and answering all your questions and interpreting your Google searches and now AI, advice,
Yeah.
The insurance model does not factor in. It really does.
Exactly.
You,
Well, and
you
people are going to realize that when they go down this path of traditional medicine and doctor after doctor can't figure out what the root cause is, they're probably not even looking for that, and they can't help them and they're not getting relief from their symptoms, then they're going to turn to someone like you because exactly what you're saying. Like, why are people paying for your time? It's for the decades of research that you have done that is more than likely going to figure out what they're
still
what the
learning.
root
I
cause
mean,
is.
it's only
Yeah,
I
sure.
it took a big investment of my time and money to go through entire years worth of training in a Institute of Functional Medicine. So it's and then keeping up with literature and all that. So yes,
Right.
absolutely right.
Yeah, so I wanted to back up just a little bit and ask you, what was it about endocrinology that piqued your interest? I mean, why choose that specialty even in the first place?
It's interesting. I kind of stumbled upon it by a chance. A fellow resident in my training wanted to switch, and I signed up for rheumatology because it's one of the things that I wanted to explore more because there was not enough exposure during the hospital rounds. And so I just wanted to learn more. But I also didn't have a lot of exposure to endocrinology. She knew she was going to be a rheumatologist. She didn't have access to that elective. It's like, why don't we switch? It's like, well, all right, fine, I'll switch. I'm interested in both, but and I just fell in love. So what attracted me is I have an analytical mind, and I love math, I love physics even more, but like I have sort of like an engineering mind a little bit. Not that I'm an engineer myself, but I like the science of it. I like the math of it. I like the logic of it. I'm a quant guy. If you know in finance, people work with numbers, right? It always appealed to me. It just resonates. And so what I immediately discovered in endocrinology is rationality and following rules, which is not always the case in medicine. Medicine is at times a more nebulous thing. Something hurt, it could be this, that, the other. You go through the algorithm, but you can't measure things always. Obviously, you often can, but not to the same degree. Endocrinology is super precise. I mean, it's precise to the nth degree. We measure things that are 10 to the minus 12. That's 1 in a trillion. Okay? Wow. That's picograms with now fairly good precision. And so, if you have pain, I mean, how do you measure pain? There's no mechanism by you can measure pain in a laboratory. It's your subjective experience. You can give it a number, but obviously it's not uniform in any sense. So it follows, it's very distinct and measurable, the hormones are, and they follow rules. So if you look at it from the bird's eye view, if you know the pathways, if you know how the body regulates itself, because the body is an amazing self-regulatory machine, it's self-correcting. And if you know what mechanisms are at play, how this gland reacts to this, and how it, like the pituitary monitors other glands, what are the feedback loops, and on, you can figure things out. And this is what I love. I love figuring things out. So, and it's more quantifiable than other aspects often in medicine. And so that attracted me. And then through replacement or suppression, as one of the senior, colleagues in my training knows, endocrinology, too much hormone, you suppress it, not enough, you give it. I mean, there's like tongue in cheek, obviously. I mean, this woman knew, God, it's so much. It's just really amazing. But jokingly, she would just reduce it to that.
Simplify it. Yeah.
Right. Too much hormone, you suppress it. Not enough, you give it. Yeah, but good luck figuring out what is, too much and what is not enough. I mean, there's a raging debate. But so that what attracted me, and I never looked back. I really like it and still do. And if I can combine it with other things, I can, functional medicine, all the better.
Right. Yeah. And so was there a point in time in your practice where you started, something frustrated you, or things were happening where you felt like you weren't able to help your patients the way you wanted to, and that's what kind of shifted you or got you to start looking into functional medicine?
Well, it was a very long process. Nothing happened overnight. I can tell you that. I mean, so it's a combination of things, and I can name a few. So one of the earliest things I discovered, even in my still fellowship, that's a training in endocrinology after you train in internal medicine, then you specialize, is this food pyramid. And, to my dismay, I realized that if you take what at the time was the standard advice for diabetics, this food pyramid, not only can you not
eat more carbs,
diabetes, you actually literally make things worse, and by a lot. So, but that was, the science of the day. I mean, and notice how it just quietly went away, right? It just disappeared slowly. First, it was some sort of a rainbow thing, and then it just kind of like went away. So, I mean, I'm not aware of any, math or physics science just being completely repealed, but obviously in medicine and biology, it happens all the time. What used to be the paradigm is like the opposite. Okay, so it obviously and clearly and early on became clear to me that this is nonsense and this is not how things are done. So it was like the first thing that undermined my trust in, let's say, traditional experts, because this is created not by some halfway, it's like Harvard scientists and no, people with pedigrees and CVs that are multi-page. Even in my training, literature review clearly showed superiority. This is medical literature, traditional medical literature review showed superiority of high protein, low starch diet versus traditional low fat, high carb diet. Okay. But then it was more. It was like this insurance model. I love to teach my patients, and this is just chronic lack of time. But that aside, COVID really was the second big thing after that. And, we're not going to go necessarily, if you want to, into all of that, but that really undermined for me a lot of things of, let's say, expert-driven and traditional medicine. And so simultaneously, I learned that very often things that are additives, things that are minerals and supplements and vitamins, that we were taught, if you have a balanced diet, you get it all. And then you realize that that's not true, definitely not in 2020s. And in general is not even necessarily true. Even if your food supply was perfect, which it's far from it, right? We don't have to disagree on that. And so this is kind of like, all right, I need to explore more. And I had colleagues that I talked to, and they, throughout the years, brought up the idea. And finally, it brought me to a realization that I just need to supplement and expand my horizons. And then I took the courses, and I'm glad I did.
Yeah, that is awesome. Awesome story for sure. And obviously you were open-minded and things were kind of like tapping you on the back, like, this isn't right. And there's
Yeah.
more, I need to do some more investigation. So I love the discussion. We're gonna find out much more. You're listening to that Dr. Diane show with me, Dr. Diane Hayden. We're gonna take a quick break. When we come back, we'll be talking more with Dr. Michael Duben. Stay tuned, we'll be right back. We're back on the Dr. Diane show with me, Dr. Diane Hayden, and I'm talking today with Dr. Michael Duben. He's a functional endocrinologist, and you can learn more about him at his website, www.restorehealthmd.com. That's spelled RESTOREHEALTHMD.com. So let's talk about your functional medicine training. We were just, before we broke, we were talking about kind of what led you down the path to even start investigating this and learning and taking all the functional medicine courses. But what are some important new things, like any new cutting edge things that you've learned while taking the courses related to endocrinology, or maybe changing the way that you practice at all? Or
Sure. There was some new things and some things that are simply either reinforced what I knew or suspected, or maybe widened and deepened the understanding. So, because again, a lot of it is based on traditional medicine, knowing biochemistry, knowing the pathways. I think their major thrust is the central role of nutrition and gut health and inflammation that drives a lot of disease, and the restoration of gut health, gut microbiome, and reduction in inflammation that starts in the gut. So obviously the concept of inflammation is very old. I think it originated, the idea, in the 1800s for sure, with the modern understanding of what it really is and its components. But the emphasis that was new to me was the importance and centrality of what happens in the gut vis-a-vis nutrition, and how it can make things really bad, or the opposite, how it can improve things if you eat right. It's not obviously only about eating, but it's a combination of things in the entire life: sleep and stress management and exercise and so forth. But that was new-ish to me. The importance of various botanicals and supplements. That's just, at least in my training, I don't know, probably to a large degree still today, not very well emphasized, because unfortunately what's emphasized is, the pharma treatments, the standard treatments. This is still considered a fringe, I think, in the current training. It's probably changing to a degree, and it's a good thing. There's definitely a drive towards incorporating alternative pathways, but it's still, I think, it's in infancy, and definitely was not present in any significant degree in my training, which I went through the entire Mount Sinai system in New York and Montefiore, and each place has multiple affiliated hospitals. So these are two absolutely huge healthcare systems. So I went through more than a dozen different hospitals for sure. And yeah, nutrition was like an afterthought. Supplements, no, not really. So
yeah, it's amazing to me that nutrition is an afterthought. I mean, I have a doctorate in exercise physiology, and we didn't get nutrition training either. And it's like, now I think back and I'm like, oh my gosh, exercise is probably 10% of what it takes to actually have sustainable weight loss, and the things that I was teaching people. It's all nutrition, and we had no classes.
I mean, look,
It's crazy.
if you're a type A celebrity and you spend 3, 4, 5 hours in a gym with a personal trainer, maybe it's more than 10%. Still nutrition central.
Who's going to do that?
Who has time for that? Who has the resources for that? It's not practical in any sense. So yeah.
Exactly.
But
So,
yeah, there's traditional lip service paid to it. Yeah. But you should eat right. But you know what? And then you have the food pyramid. Like, okay, yeah, right. Good luck.
exactly. So, what was your goal in starting the functional medicine practice? Like, where do you see yourself? Where do you want to be?
Well, the goal is again to provide better, more comprehensive care to my patients. So again, this is about achieving better health. It's not obviously there are components to it, and yes, you can target sugar and cholesterol and blood pressure and this and that the other. But overarching thing is you need time, and what I'm hoping to achieve is better health outcomes for the patients who deem it valuable enough to dedicate time and resources. So it's a two-way street. A patient has to be interested enough and involved enough for it to work. So it's kind of like a self-selecting thing. If people deem it important enough to invest time and money, then you get what you pay for. So my goal is to incorporate what I know already, what I'm still learning, together in a hybrid model of comprehensive approach to health from the hormonal standpoint, because hormones touch really every aspect of person health, and optimizing your endocrine system together with other systems, obviously, is the pathway for better health in my mind.
Yeah,
That's what I'm trying to achieve.
that's awesome. What other types of what issues do you treat? Like typically, what do patients come to you for in terms of what health issues do they have?
So my practice at this point is just general endocrinology. Well, if we talk about, again, I'm still have traditional endocrinology insurance based and whatnot. It's just I'm trying to transition slowly into the functional medicine world. But again, the distinctions are somewhat blurred. And so uh, uh, essentially, what I'm trying to build is a core of dedicated patients who really value their health and want to create a better health for themselves. So there are tools in the toolbox. It's eating, it's hormones and replacement. As far as what I see, it's just about everything. I think traditionally, what I see a little bit less of is issues related to women's health. I mean, I still see PCOS, but traditionally, this is simply, I think, yeah, it's what a tradition, turf-based thing. It's handled by a gynecologist, and so women tend to gravitate to their gynecologist for things related, let's say, postmenopausal hormonal replacement or anything else related. So I do see PCOS, I do see postmenopausal women. It's just that the angle I see them from is usually something else, although there are exceptions, of course. So that I see a lot of osteoporosis, for example, which comes usually in a postmenopausal age, and weight related issues. I would say close to a half of my practice is thyroid, about a third is diabetes, and then there's a big chunk of osteoporosis. Everything else is much less, just because it happens much less often. But I'm a generalist. Oh, and not to forget, that I really should, men's health. That's an aspect of mine that I would like to actually develop a bit more, because there's a lot of misconceptions associated with testosterone or replacement or optimizations. And this is, you can easily spend, more than an hour talking just about that, from misdiagnosis or uh, the wrong approach to the idea, to the differences between pure hypogonadal states, like low testosterone states, versus issues related only to, let's say, libido and erections. The approach has to be often quite different, and on and on and on, and what laboratories are used and what products are used. If you decide to replace testosterone, that's a big interest area of mine. So I hope to attract men to pay more attention to their health in the right way. No, not just automatically write testosterone prescriptions or pellets or anything like that.
Right. I mean, we got to get more men, like taking more being more proactive. I think it's like they're not, they don't. It's usually the female that urges them to go take care of their health,
Right.
unless there's some issues that that they're really concerned about. That'll be like the last thing on their list for sure. But I don't. You and I have had conversations about that. In fact,
Yeah.
I think we did
Yeah.
another podcast around just like testosterone shots and how your feeling was. It's not necessarily what you would recommend based on how you have to, if I'm remembering correctly, where it doesn't work, it's not as effective over time the more often you get it, and you had better protocols and things like that.
Right. Look, there's nothing inherently wrong with testosterone injections. I don't want to give off this vibe that is bad and inappropriate. It's not. It can be appropriate at times, but the question is when, under what circumstances, and like I said, like anything else, it has to be investigated individually with a patient in front of you, knowing the patient's health and concerns and symptoms and lab values, and putting it all together and presenting a couple of pathways to better health, and then choosing wisely what is a better path. Because everything, like Thomas Sowell said, like there's no solutions, there are trade-offs. Oftentimes, I mean, look, there are solutions at times in medicine for sure, but with each therapy there are trade-offs often, and even with bioidentical hormones, like okay, you can oversupplement. There are untoward side effects at times, and so on. You have to explore, like, what is the cost-benefit analysis of any intervention. Again, you need time for that. When you go to a low T center, you can be sure you're walking out with, or at least the model is that you're walking out with a testosterone prescription for which you, by the way, pay dearly, right, in cash, right? And so that's not my model. My model is not to capitalize on patients' ignorance and just, take it to the bank. My model is to explain to the patient what are the benefits, what are the downsides, what are the alternatives. Very often in men, it's, if it's dysfunction of the pituitary, you can stimulate the pituitary without testosterone, which then lead to a more robust testosterone levels. If you don't explain that, if you're just there, your business model is to sell testosterone, you're going to sell testosterone.
Yeah. Very important to know the difference. We got to take another quick break. When we come back, we'll be talking more with Dr. Michael Duben. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. You can learn more about me at www.drdianehayden.com. And I'm talking today with Dr. Michael Duben. He's a functional endocrinologist, and his website is www.restorehealthmd.com. That's spelled RESTOREHEALTHMD.com. So this whole show has been fascinating. I mean, I just love, I love what you're doing.
Thank you.
I love how you've changed your practice over and the reasons for why you're doing that and the functional aspect of it. And really it's about just, you really want to just teach people basically how to take better care of themselves and how to have better health and better quality of life and all of that. So I thought it'd be interesting if we just talked about maybe one of your patients, like a patient story that you have and kind of what the person came to you with and how you worked with them. And the teaser is how you use AI in your practice.
Okay. Great question. Yeah, it's very exciting. We're living through a very exciting time with the development of AI. Now, like everything else, obviously there's a lot of hype. There's a lot of fear mongering, and I would say a lot of maybe unrealistic hopes and idealistic hopes. So AI is a great tool, but it really should be viewed as such. It's not the word of God. It's not even necessarily the word of somebody who is really knowledgeable. AI is essentially a mathematical model that is fed the entire, at this point, internet, but then is tinkered with by the coders to align, or what they call it, they actually use the word align with the human values. But the same thing goes through medicine. So, if AI existed in the era of the food pyramid, it would recommend the food pyramid because that was the standard device. Because they want to make sure that it's safe, and they want to make sure it follows the guidelines. The problem is if the guidelines are wrong, but they're just widely disseminated everywhere, that's what AI is going to give you. Okay,
Exactly.
so it's not magic, and it's not the word of God, but it's a useful tool. So I had a patient recently who was in his early 60s, and he came to me. He was very organized. He came to me, and data in endocrinology is everything. And this is going back to my love of dealing with data. So he had a question why his total testosterone was elevated. I mean, it's not a common problem. Usually, men.
The other way around. Yeah.
Right. But he tabulated everything very neatly in columns, and not to be too technical, but total testosterone matters a lot less than free testosterone. Free is unattached to anything in the blood. Total testosterone sits on a carrier molecule called sex hormone binding globulin. If sex hormone binding globulin goes up, your total goes up too. But the body, again, being a self-correcting, finely tuned instrument, responds to that. And the response is complex, but to make a long story short, in this scenario, free testosterone remains normal, right? And you have to know it, okay? So he was looking at total and couldn't understand why. It became clear to me why, because of the numbers. The only unanswered question was, what's driving it? So he had a laundry list of supplements that he was taking, about literally a page and a half long. Most of them I knew, some of them I didn't. These are proprietary things. You don't even know what they are. And so the solution, the answer was, I'm sorry, the question is which one of those things would raise his sex hormone binding globulin, this carrier molecule. Now, you could go through each one individually and do a separate Google search. It's awfully time consuming. I mean, it's just really. So what I did was I took a photograph of this nicely presentation of data is everything, right? Presented list of supplements with a specific question. I didn't ask AI like, oh, what's going on, right? I asked, okay, which one of these supplements raises sex hormone binding globulin? And within literally 30 seconds, the substance popped up. I confirmed, because I'm sure you've heard about hallucinations. I just makes up stuff, right? So you have to confirm it. I did a Google search from reputable sources. Yes, it seems to be the case. It's been reported. I knew the answer, right? And then we looked, as confirmation, like, oh, the trend started when a year and a half ago when I started taking the supplement, and you could just see, right, the response. The patient was super happy and very impressed. So that was a lovely moment. But you have to know how to use AI and take it critically, just like anything else. So, and you need to know how to ask a question. It has to be specific, prompted well, and that's the art that not a lot of people know.
Right. No, that is so true. Yeah. And then obviously, like you did, do your own research after. Just because you get the answer doesn't mean
Right. You have
that
to.
is right.
Yeah.
Yeah.
Confirmation is super important in anything, but in particular in endocrinology. Right.
Yeah, exactly. One thing I meant to ask you that I think people will be curious about, are you able to practice or do you do any virtual practice or do our patients need to come see you in Fairfield where you are, Connecticut?
I can do virtual practice. I think I'm biased towards human contact. I think there's something that may not necessarily, well, first of all, at times you literally need to examine the patient, right? That's just not possible, right? In the telemedicine visit. A lot of what I do is intellectual and data driven. So, do I always have to put my hands on a patient? No. I mean, if you talk about, for example, thyroid disease, I'm waving to, your viewers cannot see, but right next to me is an ultrasound machine. So, if you talk about thyroid anatomy, thyroid nodules, you have to have a visit because you can't do virtual ultrasound. That's not a thing, right? But, for most things, if we talk about discussion, it's just logistically easier. If you have a list of things, it's just easier for me to see, a piece of paper than how are you going to really share, what are you going to go like this, to the screen? And obviously you can email and such. It just creates a little bit of a level. But of course, if somebody is away, cannot come, it's definitely an option. So that's an option that I offer.
And I know you're also interested in collaborating with other types of practitioners
100%.
that you could refer to and refer back to you. Or is there particular specialties that you're looking for to connect with?
Well, no, it's just now that's a field entirely new to me. I mean, when we had our prior sessions, you introduced fields I never even heard. Well, I mean, some I did and some I didn't. I mean, the people who were involved in healing through arts and there's vibration medicine and there's so many things that simply did not exist in traditional medicine. But even things that are well known, like acupuncture, like exercise therapy, health coaches. I would like ideally to have a network of cross referring. I would like to supplement what they don't have expertise in while simultaneously relying on their expertise. If somebody wants real close and detailed advice on how specifically to exercise, well, okay, we can go and see YouTube. But this is I know about exercise. I mean, I know the aspects of it, and I've heard very interesting podcasts about. But this is not the same as having literally day-to-day, first of all, training, and then day-by-day exercise of your skill. So I'd like to establish a relationship with a network of people, not simply in the functional medicine world, but whatever phrase you use, alternative medicine, holistic medicine.
Integrative, right.
You understand, and I think your viewers understand. And, you send me a list and I'm going to start actually reaching out. And if any of those guys and gals are listening, I would like to get in touch with you and form some sort of a collaboration.
I think that would be fantastic. And is the best way through your website, or do you want to give any other contact info?
Website, my phones are listed. Yes, absolutely. Okay. Yeah. I'm looking forward to that very much.
Yeah. And the website again is www.restorehealthmd.com. So I want to thank you, Dr. Duben. This has been fantastic. Great discussion about everything, functional endocrinology and more. And if anybody's interested in collaborating with you, I hope they reach out to you as well.
Thank you very much, Diane. It's a pleasure as always. I appreciate this opportunity.
Yeah, thank you. And I want to thank all of you for tuning into the show. Please join me the first and third Thursdays at 11 a.m. Eastern, 8 a.m. Pacific. Please like and subscribe to my channel, Dr. Diane Hayden, and we'll see you back here next time.
Thank you. Bye-bye.
Thank you for tuning into the Dr. Diane Show, revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. Tune in every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on TransformationTalkRadio.com. Center your thoughts on what you want and shut the door on every suggestion of fear, worry, or lack from your own consciousness or the consciousness around you. Once you master that, everything is possible. To learn more about me, Dr. Diane, and receive a free digital subscription of my magazine, visit naturalnutmeg.com.